Hello, my name is Gillian Higgins. I'm an academic surgical trainee in the NHS. In my clinical work, I am training in reconstruction and burn surgery. And in my academic work, I am working towards my MD thesis in the Centre for the Cellular Microenvironment Nerve Regeneration team at the University of Glasgow. These are some of my beautiful stem cells. In my research work, I have become accustomed to working out what questions we need to ask. The next stage is working out what skills I have to acquire in order to answer those questions, what experiments I need to perform, and how to do the analysis. This often requires venturing into the unknown, and one of the best ways to tackle this successfully is to collaborate with people who are experts in that field and have the knowledge and sometimes the equipment that you need in order to be successful and progress in your science. I have become adept at tackling uncertainty, learning from failure, being a creative problem solver and a project manager. And since 50% of my job is clinical, it means that I understand what questions we should be asking. In February and March, we could all see the unfolding pandemic that had hit China and Italy, and coronavirus was spreading through Europe. We knew that healthcare worker deaths caring for coronavirus patients were lower in places where there was high quality PPE. We knew that the UK did not have adequate quantity or quality of PPE to protect key workers and NHS staff while they were caring for their patients. I discussed this with my supervisors, Dr. Matt Israel and Professor Andy Hart, and I asked, could we make our own PPE? Could we use our 3D printers? They put me in touch with the engineering team at the University of Glasgow. Please click on their video links to see their fantastic efforts in helping. They 3D printed and injected moulded headbands and assembled tens of thousands of visors, which we then distributed throughout the country. The next step in my PPE problem solving journey was to collaborate with a group who were doing similar things in other parts of the UK, Med Supply Drive UK, who are now a registered charity. I gathered together a group of colleagues, friends and family, and we set up Med Supply Drive Scotland. We had an actor and a teacher who had fantastic communication skills and organisational skills, and they produced our volunteer training and led the PPE drive where we contacted industry and asked for donations of high quality PPE. We had an IT consultant on our team who built us a website and produced social media content. We had an occupational health expert with over 25 years of experience and multiple peer-reviewed publications in respirable aerosols. We had 2 experts in PPE with military training in chemical warfare and logistics, one of whom runs a geotechnical engineering company and uses respiratory PPE every day. We also have a textiles and design lecturer who set up our scrub hub, a fellow surgical trainee who had experience in management of national projects, and an admin assistant who kept our entire operation running. As a team, we distributed tens of thousands of these University of Glasgow visors all over the country. UK-wide, Med Supply Drive recruited over 400 volunteers, and we asked them to contact companies such as fisheries, distilleries, construction and pest control companies, places where we knew they would have high quality PPE available and perhaps they weren't using it at the time because of lockdown. We acquired donations of over 300,000 pieces of PPE UK-wide, and we delivered these to healthcare workers and social care workers who desperately needed this life-saving equipment. We delivered it to doctors, and we delivered it to nurses, and we delivered it to care homes and hospices. In Scotland, we collaborated with a group called Masks for Scotland, who are a registered charity. We were very grateful to Edith Bowman for arranging a fundraising event called For the Love of Scotland. Lots of celebrities helped us fundraise over £100,000, which was then spent on PPE, and this has been delivered to over 400 GP practices and care homes all over Scotland. We were very grateful to musicians such as Annie Lennox, Snow Patrol, Aidan Moffat, Explosions in the Sky, Amy MacDonald and the Proclaimers for supporting us and helping spread the word on social media. In our scrub hub that was set up by my auntie, and a group of very hard-working volunteers who worked full-time throughout the pandemic to make scrubs from donated materials such as bed sheets and donations from fabric companies. We collaborated with another group called the Nifty Stitchers, and together we made and distributed around 2,000 pairs of scrubs, which protected frontline staff physically and also lifted their spirits during the pandemic. Our group also worked very hard to work at local, regional and national level with health boards and politicians to advocate for the use of appropriate and suitable PPE for the worker and the task that they are performing whilst looking after their patients in order to protect them against coronavirus. We gained support from the Confederation of British Surgeons and the Federation for Surgical Specialty Associations in using a reusable FFP3 respiratory protection, such as this. These masks are fantastic in that they are reusable, they can be decontaminated, the filters can be replaced, and there are protocols available from the manufacturer about that. It's more environmentally friendly, it's cheaper, there are less disposable masks going into the bin, and it means that everybody has a mask that will fit their face. We don't have to rely on supply chains from other countries, and there are factories that can produce them in the UK. So we're continuing to try and protect people against coronavirus and to try and promote the use of high quality reusable PPE. We have had a whirlwind over the last few months. We are incredibly grateful to everyone who has helped us in our efforts. We're appreciative of their ingenuity, their community spirit and their generosity. I think it just shows you when you have like-minded people and you encourage one another to play to your strengths, then you can achieve great things. Thank you very much for watching, and take care.